welcome to today's design thinking and activity session. In this video, we are going to explore very important toxic microbiology healthcare Staphylococcus infection. It is a Staphylococcus commonly known as Staph, the bacteria that almost carry on the passenger to without problems, but also it get opportunity to such cut, injury, weaken and immunity and serious life-threatening conditions also. It is the activity we will understand how the Staph infection began and how it spread to one person to another person. We will take closer look both Staphylococcus aureus pathogen and MRSA. To the antibiotic resistance from the major challenges of hospital communities, we will touch upon the factors like that antibiotic misuses also. And using the design thinking approach, we will move step by step. First, identification of the problem, to empathizing the problem and patient experience, followed by the analyzing and correct practices of brainstorming analysis. To the intervention, to the activity designed by the students from the nursing, pathophysiologists and microbiologists and pharmaceutical industries, also to the real world clinical practice. So, let us begin the discover how that beautiful and thoughtful observation to understanding come together to tackle the Staphylococcus infection effectively.
Staphylococcus infection are also called as staph infections. They are gram-positive cocci. They appear like a grape-like cluster. They are commonly seen in the nose, skin, mucous membrane without causing any problem. But they cause an infection when they come to contact with our skin or enter our skin through any cuts, wounds or any invasive procedures. Mode of transmission: direct contact with the skin, improper hand hygiene in hospitals, airborne droplets in cases of pneumonia or any other contaminated objects. Thank you.
Now we will discuss about the etiology and causes of Staphylococcus infection. Etiology: causative organism. Most commonly caused by Staphylococcus aureus. It's most pathogenic. Source of infection: the bacteria enters through the body with the breaking of the skin. Contaminated instruments like dressing trolleys, instruments. Hospital environment: nosocomial infections. Mode of transmission: direct contact with the infected persons and wounds and surgeries. Air droplet infections by the person who is sneezing and coughing. Risk factors of Staphylococcus infection: poor hygiene, surgery, wounds, overcrowding the hospitals, skin injury, etc.
Okay. So next we are going to see about the signs and symptoms. So going to tell about that.
So let's see about the signs and symptoms of Staphylococcus infection. So this infection, according to the site, there will be various infection or various signs and symptoms we can see. So in which the area it is affected. So first, if you see for the skin and mucosal region, we can see blister, small blister formation. Pus-filled blisters can be seen. There will be irritation, itching, and swelling, redness will all be seen in the skin. If it is in a surgical site or a wound or injury site, in an open wound, we can see purulent discharge due to the bacteria. A foul odor will be present in the discharge, so that can be seen. And delayed wound healing, so the wound healing will be very slow, and again persistent redness and infection will be there. Next, if you see for the respiratory system, so if it is affecting the respiratory system, you will have persistent cough, sputum production, breathing difficulty will all be seen if it is affecting the respiratory system. If it enters into our GI system and is affecting our stomach and gastrointestinal tract, we will have the symptoms of nausea, vomiting and abdominal cramps. So according to the site, various signs and symptoms can be seen. Thank you.
Next, our going student, Jason is going to present nursing care and what are the diagnoses or there for the Staphylococcus infection.
Now we are going to see about the management of Staphylococcus infection. Then pharmacological management of the antibiotic therapy like ampicillin, gentamicin, azithromycin is given. The dosages are 5 to 10 grams per day. Given by PD dose or TDS dose. After the antibiotic therapy, there is given as a MRSA therapy and give a topical agent therapy also. After the pharmacological therapy, we are going to enter into the nursing management. The nursing managements are give the first we are going to assess the patient, assess the vital size of the patient, blister formations and the skin lesions, and a patient have a fever or a cough. That is after the assessment, we are enter into the laboratory test like blood sample, pus sample, blister sample, scalp sample. We are collected from the patient and we give to the laboratory to identify the confirmation system like bacteria presentation and WBC levels, RBC levels, platelet levels, and fever presentation, and these are noted. And last we are evaluating the patient like evaluation patient like fever, blister formation, pus formation. These are noted. After this, they give the nursing educations like private proper hygiene practice, private use equipments for hair and hygiene practices like private comb and not wet the hair and avoid the caps and helmets. These are the give the education for the patient.
So next, going to present like diagnosis, treatment and evaluation by the data point.
The diagnostic evaluation of Staphylococcus aureus are clinical assessments such as fever, chills, swelling, redness. Samples such as pus samples, pus samples, blood, urine samples, etc. The microbiological tests, laboratory tests such as gram staining, Thank you.
So, and that's bring to us end of the design thinking activity on Staphylococcus infection. Through this, that infection is that session of to explore how the bacteria that live quietly in our skin and to suddenly become the powerful pathogens. So we learned how the staph infection present through the symptoms like the redness, swelling, forms and pus formation, fever, and how serious condition it will be to the cellulitis and abscesses for food poisoning and bloodstream infection can develop if the treatment is delayed. We are moving on to this. We have also highlighted in this disease of the infection to importance of proper wound care and personal hygiene also to responsible antibiotic uses. In these cases of the challenges of MRSA is major role to remind us how this is that healthcare workers must following that vigilant about infection and control measures such as hand hygiene practices, sterilizations and PPE usage and environmental cleaning also. Now we are moving on to this. We know about that Staphylococcus is the most dangerous infection of the patient's care. That most importantly, the design thinking approach allows the looks beyond the microbiology. It helps to understand the patient's emotions, healthcare limitations and communication gap and practical barriers of the analysis. By analyzing these factors, we are able to develop more and empathetic, effective and innovation solutions for the improving patient care and preventing the staph infections also. I hopefully this video will helpful for you for that further assisting and further learning purpose. Thank you so much for watching.